Uganda lies in East Africa. It has enormous natural and economic resources that make it outstanding in the region. Despite these benefits, the country has over time suffered political instability, corruption, poverty, and an undemocratic tendency that have been responsible for poor service delivery and imbalanced resource and wealth distribution. However, government has also played
a new leader was sworn in as president
over time to the benefit of the common person. This way, key development stakeholders
communities from the dangers of consuming contaminated water.
Service delivery status. Citizen Election Watch, CEWIT, is one of the key non-government organizations aiding government in ensuring effective service delivery. One of the ways CEWIT has established neighborhood assemblies as a means to track down service delivery amongst leaders. Neighborhood assemblies have now been viewed as an automatic solution to electing leaders with contents.
And we are happy that the chairperson and the RDC and the COW have now realized our interventions and they are interested in sharing with us. We sit, we share, and we monitor. We have collective results to be shared, which is giving a district election effective participation and yielding results to the citizens that they want. For they understood that we are empowering the communities, we are actually contributing to the government's effort. We had a problem friction with them. Having realized the efforts and the reality from the people and the issues which are tabled to them through the sub-county leader of Balawi, like Mr. Tidom, one of the sub-county leaders, we really managed to break through, and as I say now, you find that we don't have any problem with them. The COW, the district leadership, the COW, the technical people, we are actually sharing, and we can ask.
The recent neighborhood assembly in Namwendwa sub-county, Kamuli district, exposed the district leaders over the mismanagement of National Agricultural Advisory, also popularly known as NADS.
Nomwenda ebintu byanabisi okwamba ku abalimi okubeera nsi balinga nga balima byebengezana nga byakuvaawo akagalo nabisi abantu babenefitize era basimu bana natsongola bwerese ebikoko abantu bali kulima yaleeta okwaya abantu bali kwaya enkoko baya embuzi baya n'ente era n'ebintu ebiyita biba birungi kuba ekirungi batukitwala biba birungi.
Bikusaba omuntu oyagemye nga tende eyo ife ng'abantu ba procurement committee bamutulagenga nti any slight mistake tujja twavunaana omuntu oyo so tikukuleetera nga bugogo buzirayo lwali wasigaza lina fo neyanziza misasi
wamuluka obwesingo aye naje okweyagana nga batusayiningisa ebigogo 10 aye nga nalisindinga ebigogo 20. So newuunya nakabala nti enkola yali etya aba bateekateeka batya era naje okwesala okwegamma enkola tiyali namulifu engeri gye basabulanga mu bigogo luno
naadisi bwe yali yakayi abalimi abaasooka baafunanga embago 2 bafuna n'ensigo aye kusaawa eno buti abalimi banaabali kwiraku embago tibali kubona waliwo n'abalimi bye baagabiranga ensigo byalo babasuubiza ati balina kufuna ki balina kufuna embago n'olwalo n'abalimi ababakaako okulima okw'embago ezo aye tibibonekanga.
CEWIT officials were impressed by their neighborhood assembly that took place at the sub-county headquarters.
Mr. Speaker, I'm overwhelmed. When we sit in Kampala and we design these projects, sometimes we don't see what is happening on the ground. For us, we are imagining. Today, I'm so happy to see that men and women also are engaging in very pertinent subjects. The subject of quality service delivery, which ultimately is meant to improve the lives of our people. I'm happy at the beginning, when the minister was presenting his report, he noted that the president made a contract with us.
Local leaders have also found it effective to conduct neighborhood assembly if leaders must realize the social contract they make with subordinates.
What were the key problems?
The key problems was lack of drugs, but now drugs are there.
Yes, they are in stock.
The staff was an issue. The visitors again. Even the doctor is there now.
Oh,
yes.
Congratulations.
Yes. Oh. Even the education department, we have invited even the headmasters.
So, to come and attend the neighborhood assembly meeting.
Yes. The problem. We have conducted several meetings here. We have invited the concerned people, like when we wanted to know about health, we invited the in charge Neighbourhood Health Center. Now he has responded. Patients have gone ahead. There are so many now. Attendance is very nice. Today we have conducted a meeting. We wanted to know about nuts. We have conducted a business. We wanted to know about nuts. We have found that nuts is not doing well. So today we have gone ahead of selecting a group committee to go to the village to find out what nuts doing.
After compiling them, we conducted the interface meeting with the appointed and elected. So from that point of view, that information is shared at KANENGO Secretariat, where the ICT Center and support from CEWIT, the technical and financial support which is extended to KANENGO, is shared equally, and we make sure that the issues of the district, the needs and the wants are addressed, the elected and appointed people from the districts and sub-county, and they access those ones as they need them. Because when I give a scenario from Barawoli where we started when 3 health centers were not operating. One in Chiga was not operating. It was closed. Gawaga, it had a female midwife. There was only a male nurse. But after the intervention of CEWIT and KANENGO on the ground with the neighborhood intervention, the local government, the director of health, the cow, shared with us and extended these health workers, the technical people in these health units, and they are operational now.
CEWIT has this year scaled up the establishment of neighborhood assemblies. In central Uganda, it works with Foundation for Human Rights Initiative. In West Nile, it works with CEFOD. In the north, it works with Accord. In the Rwenzori region, with Rweko. In Teso, with Public Affairs Center. East and West districts, with DENIVA.